Hi there, my name is Kari. I'm from Dr. Amy Rocco Nelson's office. Today we're going to talk about periodontal disease and gingivitis. It's something that actually affects over 80% of Americans, believe it or not. We're going to talk about what we can do to help prevent periodontal disease, what exactly it is. So first of all, what periodontal disease is it's when the bacteria that sits on our gum line gets underneath of our gums and it actually starts to eat away at your gums and then turns into a worse monster and actually eats away at the bone. So you can imagine that if something's eating away at your bone, eventually your tooth's probably going to fall out. So this is why we want to not get that bacteria inside of our mouth, and we're talking about how we can prevent it. So first of all, what you do is obviously the teeth brushing 2 times a day, 2 minutes. I know it's a drag, but you gotta do it. I usually recommend an electronic toothbrush. It actually usually turns off after 2 minutes, so you know for sure that you're gonna be getting those 2 minutes in there. I don't care what kind of electric toothbrush you get, there's lots of them on the market. The Sonicare, the Oral-B toothbrush, they're both really fabulous, but make sure that you do some investing in that. If you buy a $5 toothbrush, you're definitely going to get a $5 job done. So definitely invest in that. So the next thing we're going to talk about is dental cleanings. If you don't come in every at least 2 times a year to get your dental cleanings done, you're going to end up with periodontal disease at some point in your life. And believe it or not, it's not just for old people, like people like to say. I have healthy 19-year-olds come in and I have to break the news to them that they've got gum disease, and you know, if they keep this up, they're not going to have teeth by the time they're 50 years old. So first off, a toothbrush maneuver. If you're going to be using an electronic toothbrush, just make sure that you have your toothbrush not head on, but actually at an angle. Make sure you're brushing your gums as well as your teeth, because your gums, like I said, that's where the bacteria hides. That's what you're going to want to be stimulating. So back and forth movements, make sure you're getting the cheek side, the biting side, and also the tongue side as well. I almost forgot about talking about the flossing. I know, the dreaded F word, it's awful. But when you're floss, you actually want to make sure that you get on both sides. So when you pop that floss down, you want to rub it up tight against that side of the tooth and rub it up tight against that side of the tooth as well. 2 little compartments, both need attention, of course. And I mean, if you think about it, if you don't floss, it's basically related to, you know, that stuff that's in the back of your fridge and that container that you never ever want to open. So you're willing to wipe down the shelves, but you never actually want to open up that Tupperware in the back. Yeah, in between your teeth is actually equivalent to when you actually pop that old container open. Yeah, it's kind of gross. So gross. Anyways, so floss your teeth essentially. So we talked about brushing, flossing, a couple little tidbits that you want to know about that may be why you want to actually start doing these things that we're talking about today. Believe it or not, bacteria that causes gum disease is contagious. So if you have somebody else in your family who you don't know but notices bleeding gums sometimes, that's infection. That's the problem. So what we want to do is we want to be able to not... You can't not share drinks, let's face it. I mean, I do it with my kids all the time. So, I mean, really just know that if you're not going to the dentist and you're not getting your teeth cleaned properly and somebody else has that yucky gum eating infectious disease, periodontal disease, that eventually you in fact will have it too, because it is in fact contagious. Yeah, it's really gross. It's contagious. It's gross. So go to the dentist, brush your teeth, do your flossing, because nobody wants to be sharing that kind of stuff. It's gross. So anyways, moving on to the next thing. It's a silent disease. It really is. I mean, believe it or not, people who have periodontal disease are more higher risk for high blood pressure, stroke, diabetes. If you're somebody who's wanting to have kids, believe it or not, you're more higher risk to have a kid earlier than they're supposed to actually pop out. So premature birth, low birth weight babies. That's a real thing too, because this periodontal disease is just a nasty thing. So we talked a little bit about how we can take care of those things today for you. Go ahead and share this with your friends. I'm going to be doing a whole bunch of more videos. If you have any questions, go ahead and post them underneath the video, and I'm happy to answer anything yet. Thanks so much. We'll talk to you soon.